Some of us, I think in the early 2000s, talked about globalism, but I think that the COVID pandemic, especially in healthcare, for me, really underscores why I think global healthcare is the next big thing.
Hi, everyone, and welcome to the next big thing in health. I'm your co-host, Matt Isles.
And I'm Laura Evans. This season of The Next Big Thing in Health is sponsored by Teladoc Health, partnering with health insurance providers to transform the care experience for their members. Visit teladochealth.com/AHIP-2021 to learn about its perspectives on the path forward for integrated virtual whole person care.
Our guest today is Juliet K. Choi, President and CEO of the Asian and Pacific Islander American Health Forum, a nonprofit organization that influences policy, mobilizes communities, and strengthens programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. Prior to her role, Juliet served in the Obama administration as the former chief of staff and senior advisor at two federal agencies, the Department of Homeland Security and the Department of Health and Human Services. She also previously led disaster relief operations and strategic partnerships at the American Red Cross as a member of the disaster leadership team. Thanks for joining us today.
Thanks, Matt. Really happy to be here.
Great. Why don't we go ahead and jump right in? And, I gave a very brief overview at the beginning, but for our listeners who aren't very aware, could you maybe talk about what the Asian and Pacific Islander American Health Forum is and what your organization does and focuses on?
Sure. Thanks so much, Matt and Laura. Again, really great to be here and with all of your listeners. In a nutshell, if you don't know us, I invite you to visit our website. We're at APIAHF.org. We're the oldest and largest health justice organization for the Asian American, Native Hawaiian, Pacific Islander communities across the country. And so, in a nutshell, what that means is we have the humble privilege of serving as that health justice advocate for our communities when it comes to health equity. Stated another way, we work with our network of community partners across the country. We have a network of over 100 partners in almost 50 states and jurisdictions where we're really fighting for health equity, building community power, and community capacity.
Juliet, let's talk about COVID-19. And I understand your organization has developed a comprehensive set of resources over the past year to help these communities access information about COVID, treatments, and vaccines. Let's talk about those resources and how they're helping the populations you serve.
Sure. So if I can, we are July 2021, and if I could ask us to imagine where we were March, April, May of 2020, all of us, you, me, my friends, my family, we were all curious. What is COVID? What are the best public health practices? The information, the guidance was literally, I thought, changing week to week. And we wanted to do what we could, not just as healthcare professionals and advocates, but just from a standpoint of taking care of our families, our neighbors, and communities. So with that backdrop, I ask and invite our audience to think about the diversity, the resiliency of the Asian American, Native Hawaiian, Pacific Islander communities. And if you can understand, a significant portion of our communities are immigrant families. And so what that translates into is when we're thinking about the scientific information about COVID and public health guidance, that's really tough information to explain in lay terms, I would say in English. But can you imagine trying to explain all of those provisions in a way that's relevant both to your culture, but also in language? So as a result, what we've been working on for the last 15, 16, 17 months has been growing a network of our community partners to take the federal scientific information, make that bite-sized, digestible, both culturally in a relevant way, but also in language. And to do that, I do have to share with you, has been no small feat.
Wow.
I'm proud to share now that some of the key examples include we built and grew what is our National Health Response Partnership, which is a national network of over 25 national regional organizations that includes their respective networks of local partners as well. And with that network, we worked around the clock to make sure that we could make this information, again, available in language and in a way that's culturally relevant. I think if I can highlight a couple of recent examples, I would include, and I think maybe later today we'll talk a little bit about this. As the country has grappled with COVID, the country has also grappled with this new modern chapter, historical chapter of racial reckoning. And for the Asian American Pacific Islander community, as we have been dealing with the disparate impact of COVID, we've also been dealing with an incredible consequential wave of anti-Asian violence.
Mm-hmm.
And so, for example, earlier this year, we created, a Know Your Rights toolkit on what hate crimes are and what hate incidences are, and to make that available to our communities. And I wanted to create a gold standard and try to model what we want the rest of the country to do. We created that toolkit and made it available in 25 languages, 25 Asian, Native Hawaiian, Pacific Islander languages. The reason why this is so illustrative and critical is that for our communities, all of us, we've been trying to promote, encourage, educate our families and our neighbors to feel safe, understand the facts as to why getting a COVID vaccination is the best measure to take care of your family when it comes to COVID. And the reality we discovered is that while some of our family members had those precious COVID vaccination appointments, our families were shuttered in because of the fear of anti-Asian violence. And so that's an example of where we're dealing with a global pandemic, but it's important together with our community partners to understand where are our families and what kind of information do we need to make available.
So how are you getting those messages out? Was it on social media? And I know it's continuing down the line, but is it social media that you're using? Is it just a variety of different, regular, traditional media too?
The short answer is it's all of the above. It is all of the above. And we are learning, across the diversity of our communities. And I don't think it's unique to the AA and HPI communities, but also for communities of color and particularly immigrant communities. Social media is highly impactful. And for different communities, different channels of social media are more effective. I would say the biggest thing is making sure that any information and messaging is delivered through trusted messengers and partners. So people who look like you, people with whom you can relate to, your family physician, your faith leader, your family member, maybe it's your local elected official. And then through social media, it is making the information in writing available through translated copies, but also through interpreted channels. And so, we invite folks to visit our Facebook page and our Twitter channels, because that's how we're able to promote the latest offerings that we have.
That's such incredible work that you're doing, both on the communication side and combating discrimination and Asian American violence. Maybe we could just stick with that for a moment to understand, with the devastating rise that we've seen across the country, What other solutions do you think we need to be talking about as a country? I mean, it has just been astounding to watch the impact over the past year. What conversations are we not having as a country about this?
Yeah, I really appreciate that question, Matt. I mean, I think that's the first step, exactly the question that you asked. And for the listeners that are joining us, your place of employment, your place of worship, your community space, I would ask you to raise that question and elevate that question and that opportunity for dialogue, because what that action does in and of itself is that it creates space, it invites a safe space for a lot of our members to step forward and actually reveal and disclose what's actually happening. I want to share a personal story and then highlight also another example of where we're also learning from all of these experiences. I, like you and some of our listeners, I'm based in Washington, D.C. I consider this my home, my adopted hometown now. I'm minutes from the Capitol building. And I have to say, in my over a decade of living in Washington, D.C., it's only in the last few months that I've experienced a handful of verbal assaults because of the color of my skin and what I look like. I'm not a shy person. I think I can speak up for myself. But it's in that moment when you experience that, it's traumatic. And I know so many other persons of color, both in our community, but also in our BIPOC communities, experience this. So I think creating that kind of space and having a sense of empathy. In terms of bolstering our efforts as an organization, we created, I'm very proud to announce this, a strategic partnership with the National Asian Pacific American Bar Association. It is the largest grassroots organization in almost 50 states. It's the country's largest organizations of API lawyers and judges. And through that partnership, we're continuing to create opportunities for dialogue, but again, additional materials like Know Your Rights. So for example, bringing it back to COVID, we've also heard stories of the intersectionality of anti-Asian violence and the COVID vaccination experience. Like you and me, hopefully more of us and our friends, we've had the opportunity to get our COVID vaccination. But there are so many individuals when they step up to get their COVID vaccination, perhaps because of the language barrier, they're asked to produce identification and proof of insurance. And you and I know both that is not a requirement in order to receive your COVID vaccination. And so we are creating these materials of know your rights and know your facts. And those are the examples of, strategic partnerships and these kinds of conversations also with AHIP, I think helps us to bolster these kinds of discussions and increase and enhance awareness for all the communities we're trying to serve collectively.
So, Juliet, one thing that this pandemic has done is it's really highlighted the major gaps that we have in our digital divide. Are there any programs or initiatives that your organization is implementing or has already put in place to help expand broadband and to narrow that gap?
Yeah, I love that question, Laura. I wish I could say the health forum and our health justice mission. I wish I could say we've created our own 5G network of advocates, right? But I think what's core to your issue with regard to broadband, I tie it to the issue of with the innovation of technology and the opportunity to share more information rapidly. Some of these issues and opportunities, I firmly believe, face are cycles of opportunities and challenges. And when it comes to broadband and we think about the COVID context, the innovation in healthcare, the barriers of language, and access to information because of language. One of my concerns is that the digital divide is also amplifying the literacy divide. And when you combine the two, when there are crisis situations like a global pandemic where there is an absolute sense of urgency to get accurate and timely information out to our communities, my concern is that while broadband and digital access creates opportunities, we need to be top of mind of the underserved and the unmet needs of communities. Now, the good news story is some of the conversations the Health Forum has engaged in, we've brought these issues to light together with our network of partners to the Biden administration, whether it's the White House or HHS or the Department of Justice, because there is an element, if you don't take into account language, that is also a form of discrimination or national origin discrimination.
Mm-hmm.
Now, the other opportunities, and this is, where crisis, I do think, can also bring out the best in us, is that the corporate sector has also very much stepped up. There are corporations and corporate partners, for example, like Verizon, that has made a really bold statement and investment in the AA and HPI communities, recognizing that there's opportunity to overcome that digital divide. But when I was joking or chuckling about our 5G Health Forum network, there's nothing that's going to replace that network to network, that trusted messenger, partner to partner outreach and communication. So I think going forward, there are opportunities through innovation, but it is really important to acknowledge the value and the need for greater investments in community partnerships going forward.
Mm-hmm. Teladoc Health, the leader in virtual care since 2002, has built the only scalable platform for integrated whole-person solutions. A partnership with Teladoc Health helps ensure that health insurance providers, employers, hospitals, and health systems are prepared for the future by supporting the growth of virtual care. To learn about Teladoc Health's perspectives on innovating to ensure access to integrated, virtual, whole-person care for everyone, visit teladochealth.com/AHIP-2021.
Building on that theme of, opportunities, we know one of our biggest gaps that we face right now is in terms of collecting better data to help different populations, especially underserved, underrepresented communities. And I also know that you were recently appointed to an RWJF, Robert Wood Johnson Foundation panel, a great organization. What kind of data do you think would be helpful for us to collect, and how would it be used to improve health in these communities?
Yeah, absolutely. Gosh, if I had the perfect answer to that, we would be working on a whole lot of different things. So I'm so glad you mentioned Robert Wood Johnson Foundation. Their leadership and innovation and convening different leaders for its newly formed National Commission to transform public health data systems. I'm just one of many just incredible commissioners on that entity. In terms of type of data we need to collect, identify, I like to think about a framework, if I can put it this way and articulate it this way, is how do we take our public health data system, and really democratize our data? So for me, I think a critical question is, what type of data do we need to collect? But why do we want to collect the data, and what kind of reform do we want to envision and commit to going forward? And so that's why, through some of my other really good friends and colleagues, like the National Urban League and Mark Mariel, we recently are talking about in an article about the real need to democratize data. So if you take that kind of lens, I think it opens up the possibility. Sure, absolutely. The classical data elements we need more of. I want to see more sub-ethnic disaggregated data. I live in DC now, but if I lived in the state of Florida, you know what? And a lot of the public health data reporting, I would only show up as other. And I'd like to believe that myself and my community, we count a little bit more than just other. The ability to capture language and disability. But again, if we think about democratizing data for a better well-being and a holistic society, I think this invites us to think about how do we counter this notion that, you know what, your zip code is a big predictor of how well and healthy you are or not. And so if we think about data holistically, we can think about housing and education and employment and healthcare and put that together for a vision of leveraging a public health data system that drives us for a more holistic, a healthier society. The last footnote, you know, like you, I like to read different articles and publications. You know, Forbes recently continued its latest publication. Did you know that there's a world index on happiness?
I
Um,
did. Yes.
right?
I
Yeah.
love looking at it.
Missed
Yes.
that
Yeah.
one.
Yeah, and it's an index created by the United Nations. So, you know, there are different channels to read about that. But I invite us to think about, you know, democratizing data, not just for identifying the gaps, but for producing a healthier, happier society. In that United Nations driven index, you know, Finland came out #1 for the 4th year in a row.
Mhm.
And I've got a slightly competitive side to me. The US is ranked in the top 20, but I'd like to see us hit the top 10 sometime soon. So that's a different way of how I like to think about what do we want to do with our public health data system.
Yeah, the US is number 18. That's
Yeah.
much too low. I'm competitive like you, Juliet. We need to get up there.
Yeah, let's increase that rating. Yeah.
With you. I do want to talk briefly about your current role with the Asian and Pacific Islander American Health Forum. And Matt explained your bio off the top that you were with the Red Cross, you were with HHS, you have a law degree. So I'm curious about how all of that is contributing to what you are doing now with your organization.
Yeah, absolutely. You know what? This is really an homage to my parents, I have to say. I'm the proud daughter of Korean immigrants. My folks came to the U.S. in the '60s, and as a kid, I just remember. For those of us that can remember, my dad used to record Walter Cronkite and the CBS News.
Yeah.
And he would play it back, and I would ask him, "Why are you doing that?" And he said that because of his accent, he wanted to work on his accent.
Oh, wow.
Because, you know, sometimes, you know, folks understood him and took him at face value, and other times he felt, you know, a little bit removed because of that accent.
Hmm.
Now, my mother, on the other hand, had highlighted that, you know, how lucky am I to be an American girl, an American kid, and have the opportunity to bridge a couple of cultures and a couple of languages. And that's something special. And somewhere, somehow, uh, I need to find a way to help communities and serve the public. So I will say that's sort of a wind up to say, over the last few years, I witnessed, and you had highlighted my background with the Red Cross and as a civil rights lawyer, and having been at Health and Human Services and actually U.S. Citizen Immigration Services at Homeland during the Obama days, over the last many years, I just had this compelling, uh, this compelling vibration in my gut that over the last handful of years, our immigrant families really faced a really tough anti-immigrant agenda. And there have been plenty of reports, whether it's the Commonwealth Fund or Kaiser Family Foundation, that highlighted that because of immigration status and language and cultural barriers, our communities were not accessing the healthcare that they needed. And fortuitously, you know, English is my first language. I feel like I can bridge different cultures. I can bridge federal government to community to private sector. And I just had a real hankering for really wanting to come back to the nonprofit space to uplift really the resiliency of immigrant communities. And fortuitously, you know, I was presented with the opportunity to join the Health Forum, an organization that I've actually worked with over, you know, over the last decade. So it's one of those, you know, sometimes you wish for something, and sometimes it happens. So, you know, I'm learning a lot in this position. You know, there are a lot of lessons learned, but each day, you know, I'm just really, really inspired by our partners, our communities, you know, and being able to share a dialogue like this with you and your audience.
Well, it really brings all of the corners of your background together quite beautifully.
It does. And just because we have you, I have to ask this question, Juliet. Given the disaster relief operations you led at the American Red Cross, and you mentioned lessons learned, and anything that we need to take away from what you learned at the American Red Cross and apply it to COVID?
Yeah, absolutely. COVID, you know, pandemics, crisis scenarios. Uh, I'll say a few things. You got to have a North Star, right? You know, in terms of our values and our principles. And that's something, a really, really valuable lesson that I got to see play out in so many different ways when I was at the Red Cross. And having that North Star is really, for me, is meeting the humanitarian needs and seeking out those tougher challenges and issues to address and making sure the most vulnerable are not left behind. Two, when there's a crisis or a disaster, believe it or not, there are a lot of elements that are predictable because crisis happens again and again. So when we've got the time or the readiness, if you will, let's figure out what those predictable elements are, plan for it so that we have greater bandwidth to deal with the unexpected. Three, the power and the glory of partnerships to meet unmet needs and to sustain one another is incredibly critical. And it's hyper critical to make sure that when we establish those partnerships, we grow, nurture, and sustain them. Four, you know, every crisis, as bad as it can be, there's always opportunity for innovation. And I do think the best, the brightest people show up expectedly, unexpectedly for innovation. We should celebrate that. And last but not least, you know, I really believe in that public servant model of leadership. And so in crisis, it's important to, with your colleagues, to uh, embrace that sense of humility. And as you're doing the humanitarian work, celebrate the joy in the work that you're doing.
Thank you for spending so much time with us here today, but we always have one last question that we have to ask of all our guests. So here it is. What do you think is the next big thing in healthcare?
Yeah, I love your question, and I know some of your former guests. I love their responses. You know what? For today, in this moment in time, in July, I'm going to go with global healthcare. And let me say that's global, GLOCAL, right? Some of us, I think in the early 2000s, talked about globalism, but I think that the COVID pandemic, especially in healthcare, for me, really underscores why I think global healthcare is the next big thing. You think about the need to be able to access care wherever you are. It's care for yourself, but if you're able to access care, that means you have a higher chance of being able to take care of your neighbors and your communities. And something like a COVID pandemic or any pandemic does not identify with geographic boundaries. Um, and in order for us to take care of one another and beat this pandemic, all efforts are local, but there's an incredible global impact here. So I think the opportunities, the challenges, the solutions, the innovations. I'm just gonna round it out and say today I'm going with global healthcare, Matt and Laura.
I like it. It works.
Love it.
That works and it makes sense.
Love it. Thank you so much for both your time, but all of the work that you've been doing and all of your service throughout the years. Thank you so much for being with us today.
Thank you, Juliet. A pleasure to speak with you.
You too. Thanks so much, Laura. Thanks, Matt.
Recognizing the critical role that virtual care plays in the healthcare delivery system, Teladoc Health helps health insurance providers coordinate and deliver care for all members, including their highest risk populations, by providing a front door to care. From chronic condition management to mental health to primary care, Teladoc Health personalizes and integrates whole person care for members. Visit teladochealth.com/AHIP-2021 to download our brochure and learn how virtual care is delivering value as the preferred entry point to health.